We are launching the e-health services, what we call the digitization of health services in the Free State. It's a number of platforms through a number of problem areas that we have encountered. Firstly, COVID-19 taught us that technology is inevitable as part of continuous improvement of provision of quality services. Throughout the world, people are doing things and through technology. So we have had to be in the cutting edge of technological development so that we keep up with the pace global standards, but also we improve efficiency of provision of services to all our people in the province. For instance, the assisted reality project, which is part of the broader telemedicine landscape. In countries like Germany, they do it seamlessly. In our part of the world, that is seen as a distance reality, and in fact we are likely to be one amongst the very few, if not the first, in South Africa that are doing that, where health services, specialists will be based in a particular area, or they will be in any part of the province, but they will still be able to provide specialist advice to junior doctors and other health care providers at the cold face of service delivery. For instance, we demonstrate in the app, in the solution here, where a patient is attended to by paramedics, which is part of the pre-hospital services, but they are able to speak to a specialist at Universitas Academic Hospital. So there's continuous provision of healthcare services to that patient instead of loading that patient into a transport, EMS, to a health facility, in which time, a valuable time can be lost of saving that patient's health. So developing this enables us to be at the cutting edge of technological developments. E-filing services, e-recruitment, the patient records are going to be digitalized. You're not going to have a problem of patient files that get lost. So these are improvements that you are going to be seeing. Come January, you will be able to see this kicking in action. We have demonstrated the ambulance app, where people are able to track where the ambulance is, when it was called, how far it is, as a patient that is waiting for it as well. You are able to see where that ambulance is. You are able to know as a department issues like the cost of running healthcare services. So it's an exciting time, and we are glad that this is happening in our lifetime.